food pureed, and they're requesting that they have like a cookie or a piece of cake or something. And what I basically just want to show you is how to do a slurry. And you can, actually present it at the table like this, the whole piece of cake. And then I'm just going to start gradually adding a little bit of milk to it. I think it's really important when we have our residents that are not wanting their pureed diet is to always remind them why we've recommended the pureed diet, because it's always going to be because they have a swallowing issue and that they could choke on it. And then just to kind of mash, and this makes just a nice little slurry with the frosting. And we're just going to strive. And it's it's just the very same piece of cake, but it's a little smoother and it's going to be easier to swallow. One of the things I'll say to people is that, you're eating the same food everyone else is eating. We've just made it a little bit easier for you to swallow. We've blended it so it's easier for you to swallow. Cookie might be is maybe going to be just a little bit trickier, and that might have to soak just a little bit. The other thing I want to talk about is also a little bit about resident rights with diet recommendations. And when I come in and see someone and they have a swallowing problem, and I know that they, maybe they've had a video swallow study, and the recommendation is pureed diet textures, nectar thick liquids, because they've aspirated on thin liquids. They've, aspirated on maybe mechanical soft textures. We all sometimes, will aspirate, but the thing is with the diet recommendations is that patients, they have the right to refuse the recommendation, and we really need to be able to balance resident rights, resident safety, and residents' quality of life. And I guess the way I sometimes approach it is from the standpoint that if you don't want to use a walker, we're not going to have you sign a waiver that you have to use a walker. If you don't want to use your call light, we're not going to have you sign a waiver that you're not going to use your call light. But the reason I want to talk about the waivers a little bit too is because they don't hold up. They don't hold up in court, and they're becoming increasingly more considered by the court to be coercion, and that each party isn't equally represented because they look at it from the standpoint of the facility as saying, this is what you have to do, and if you don't do it, we don't want you to be able to sue us. But the way it should go, and there's only a handful of people that this might be an issue with here, is that if they say, I'm refusing this diet, I'm refusing my pureed food, I'm refusing my nectar thickened liquid, is that we should be having a meeting about that and then talking about the risks and the benefits. And when I talk with somebody, for instance, we all know we've got, a couple of guys here that don't want to have the pureed food. I'm going to be really blunt. I'm going to talk to them about what could happen is that you could choke, and yes, that choking episode might resolve. It might not resolve, and because, if you're a really big individual, you're going to have to be lowered to the floor. You're going to have the Heimlich performed on you while you're in the dining room, while you're laying on the floor with all of the other people in the dining room around you. And that Heimlich maneuver may not work. You could die from this choking episode. But I'm going to go through all of that with them and then ask them to repeat back to me what I've told them about their choices, okay? So that if they want to go ahead and still choose not to have that, if they have the capacity to make that decision, and that's another tricky issue is capacity, because if you can't balance your checkbook, does that mean you also can't make a decision about your diet textures, okay? Does that kind of make sense? So with somebody with dementia or cognitive issues, that's going to be something where we need to probably pull in a family member and kind of go over it with them. But the problem with the waivers is we sign off on a waiver, we put it in the chart, and it's never, ever addressed again. But what needs to happen is if somebody doesn't want the food, the recommended diet textures, is to, have that meeting, document what the risks are, document what the benefits are, document what they want, why it's important to them. I mean, I've got to say, I have to be perfectly honest. If somebody tells me when I'm 90 years old, oh, you cannot have those Lay's potato chips and that Pepsi, I'm going to be flippin' mad. Even if I know I could aspirate from it. And the thing is that, patients, residents, they have a right to make those decisions. And it just, the way it should happen though is if, this gentleman in, the dining room, if it's snack time and they want a cookie, the way it should go is, the reason we're recommending this is because you have a swallowing issue and we're blending your food to make it easier for you to swallow and safer. We don't want you to choke. We don't want you to have to go to the hospital. We don't want you to get pneumonia, okay?
So you say that every single time?
I would. I would keep reviewing it and reviewing it and reviewing it. But the thing is that if you're the activity person, if you're the CNA, and if this person is refusing the food, I would then, I'd go through the little spiel, and if they say, I don't care, I want the potato chips, then I would go and get the nurse, the charge nurse, have charge nurse come back and talk a little bit more about why that's important, and then document in the chart every time they refuse. That's going to be what saves you if somebody chokes. That's going to be what saves you, is that documentation, that ongoing, continuing education about why we've recommended this. Do you guys have questions? Is it any of this make sense, or kind of? We're really moving away from waivers, and that's kind of questions, concerns.
I have a question.
Okay.
They have those form things that you can make your food look like.
Mm-hmm.
Have you ever done that with desserts?
I think that'd be a great idea. And this, like this cookie, I've kind of slurried this cookie, but this is tricky because it's got hard chocolate chips in it. It'd be more ideal with like a sugar cookie, a cookie that didn't have a lot of texture to it.
Is that okay, the one you have there?
I probably would not go with that because I'm having too hard of a time.
To get the chocolate?
Yeah, like if you blended it with a blender, it would be fine. But it's just doing it by fork. Yeah, and I understand that we're kind of wanting to do this so that the person that we're doing it for can see that it's the very same thing that everyone else is eating,
So, we also have to take into consideration the dignity. So when you're having that conversation, you have to pull the person up to the hall or into an area where, because inevitably that they're going to get upset and it's going to affect the other people that are in the same space.
Yeah. Well, and I think it's probably okay to talk a little bit about, that's just, that's the same thing everybody else is eating. It's safer, and then if it becomes an issue, I would probably get the nurse. But I just one of the things that we know is that we have, if we did a video swallow on everyone that was on a thickened liquid, we know that there's going to be some people that can actually tolerate a thinner liquid. But a lot of times now they're coming from the hospital, they've had a stroke, they've had an episode of pneumonia, and before they've even had any instrumental assessment, they're placed on a modified diet and thickened liquid, and then they come to me. And I think, okay, we have to have this. And in actuality, probably, I would say, probably maybe 50% of people that we have on a thickened liquid probably don't actually need it because they've either not had that instrumental assessment while they were in acute care, or they've improved while they've been here. A lot of times I'll try and send them back to the hospital to get a better idea of what they can tolerate. But even from a facility standpoint, your nectar thick liquids, I've heard anywhere from it's like, I don't know, $800 to $1,100 a month. Maybe Debbie, you could probably speak to that. For somebody on a thickened liquid, it's expensive, isn't it? It's a big.
Well, I've never honestly broken down the cost.
Yeah. Here's this other little
I'm sure it is, but also the state surveyors like to model stuff way more in.
Oh, yes, absolutely.
Because it's more consistent.
Was this chocolate, this little bar? Was that a
It
chocolate?
was a brownie with cheesecake in it.
Okay, because I put apple juice on it. I thought it was like a berry thing, but,
Okay.
but you can kind of see the slurry consistency, so, okay. The thing that really isn't helpful is, like, I've been in some dining rooms and where I'm kind of walking through the dining room and somebody is not wanting their modified diet or their thickened liquids or something like that. And the person who's serving it will say, talk to her, and point at me. It's her fault. She's the one. She's the one. And I think that doesn't,
not right.
it doesn't help at all, and it just tends to kind of aggravate the situation. But I think a lot of people, especially our people that have some cognitive issues, it's really helpful to them to remind them, you need to use your walker, you need to use your collie, you need to have your food pureed. And it's just kind of that same kind of a situation. So what kind of questions do you guys have? I feel like I've thrown a bunch of stuff at you. Does the slurry make sense? Okay, and your question about the molds,
Yeah.
I think those are cool. And then have you seen at some of the bigger hospitals, what they're doing is they're pureeing the food and then they put it into one of those frosting bags and then we'll make it look really elegant on the plate, you know, they'll kind of, so I mean, quite an art to it. But it's just, the worst thing, and you know, we've had a couple of situations where somebody was on a modified diet, they refused the modified diet, they didn't have any teeth, and they were just given the Dorito chips, and they choked, and nothing was said to nursing at the time about this person refused, and they had to do the Heimlich, and I mean, even 90 minutes later, this person was still very compromised from a respiratory status, you know, and that ended up being a vulnerable adult situation. But in a situation like that, if somebody's absolutely refusing, you need to, you know, document that you've talked to the nurse. But I can't put into words how difficult it is to kind of try to balance the patient safety, the patient rights, you know, all that. It's really, you know, because you have the right to make a decision, but yet we want people to be safe. And I'm always going to err on the side of caution. I'm going to always say, this is what is safest from a swallowing standpoint. But all I can do is make that recommendation, and if somebody chooses not to follow it, you know, because how many times do you recommend that they use their walker, they use their collar, and they just ignore you? I mean, you've done your job as a professional to tell them what they need to do. And, you know, some of them are going to be really diligent, some of them aren't.
But I think a lot, like anything else, a lot of them forget from time to time too.
Yeah,
So
and need
we,
lots.
you know, telling them this is why we're doing it.
Yeah.
We're doing it for a safety standpoint is important to, you know, be able to tell it to them every day.
Yeah.
Well, I'm just thinking that, you know, we don't have that, was it like 4 people on puree diets? So it's not a large group, but if you already are having to give up normal texture, the least you could do is make it look as appetizing as possible.
Oh, yeah,
And including the shapes, I mean, that at least, because there's nothing worse than feeding somebody and they don't even know what they're eating.
Right.
Because they can't tell by what it looks like.
Right.
So they don't, you know, they don't get hungry.
Yeah.
Where if you had it in shapes, maybe that would at least give them the idea of what they're eating.
Yeah.
Aides can help by telling them though too. Say, you know, oh look, doesn't this look good? You have your salad. I was just talking, they used to always carry the salad, so that would be clues too, right?
Right, and then the other thing too is I think the slurry idea is really a nice thing because I think that's
Get to
where
see
they
it.
feel at snack time when they, you know, if you're just gonna get some pudding or something and every day
Yep.
it's like you just
Same
get some
old.
pudding and everybody else is getting lemon bars and sugar cookies and things like that, where you can make it a pretty easy
Sure.
slurry. So, questions?
Is there a safe way to eat chips?
With supervision and very small bites. And you know, a lot of times what will happen is when somebody refuses something and says, I'm going to have those potato chips anyway, there's an episode that is pretty scary to the resident and the family to where, you know, I have to say, a lot of times when I have that meeting where I talk about, you know, you can, because I'm really blunt, I talk about, this can be life-threatening, you can die. You could be on the floor in the dining room and the Heimlich may not work and you can die. And then, you know, there's like, family, and maybe we'll go with that.
Well, and there's better chips than other chips. Like Dorito
Right.
chips, I would think is the worst chip.
Doritos are.
They don't ever get soft.
Yeah.
Where like
Yeah.
potato
There's a-
chip, it does eventually get
Yeah, it does. I mean, like those really nice Lay's
Little,
chips.
yeah.
Yeah, that are real thin, that just melt.
Yeah.
Yes.
Do you remember those baby yogurt things?
Yes, because those melt too.
Yeah.
I mean, that was a really good idea too, to kind of just, see what kind of options
Have
there
you seen
were.
the baby snacks that are yogurt
Yep.
that melt as soon as they hit their mouths? That's what we've been using for.
Because and that was nice though, because you put those into a plastic bag,
Oh,
where
yeah.
it didn't look like it didn't look like it was a
Or a
container.
little cup, no, we never
Yeah.
serve it from the container.
Yeah.
It's always in a little dish or bowl or something.
Yeah, this is really hard, and this is hard at every single facility I've been in, is trying to balance what the resident wants with what's the safest. It's really, really tough, and but the thing is we're really moving away from those waivers, and just kind of be kind of positive. Oh, it's what everybody else is eating. They've just blended it to make
Right.
it easier for you to swallow. We just don't want you to choke on it. We love having you here. We don't want you to have to go to the hospital. Just to kind of, just be kind of matter of fact about it. And questions? I left some kind of handouts up, but this is kind of about waivers, and this is like a kind of a longish article about patient wishes before risks. And basically, this is, they've got a lot of good references in it, and it talks about what we need to be doing is looking at patient wishes first. That's the priority before the risks. I can document the risks, I can tell them about the risks, but their wishes are always going to trump the risks. Does that make sense? Okay.